Hi there. Hi, Renee. Welcome to the live. Hey, Yan. Hey, Becca. Miss Nyambura. Akoth. Karibuni sana to today's live. And I'm waiting for my co-host, Brian Jue of My Health Insure Talk, to join the live. Then we can get started. Thank you to everyone who's joined. And I see Brian has also joined the live. So I'll let him in. 1 minute. Okay. Hey, Brian. Oh, wow. It's taking a minute. Oh, wow. Okay, let me try. Okay, accept. Okay, my health insurance talk is not able to join. Brian, I'm not sure what's happening on your end, but let's try again. Hey. Always on the move, always on the move, Brian.
Blame it on the climate conference.
Yes, yes. But how are you today?
I'm doing well, and yourself?
I'm good also. Um, so I just came back from a short break. Um, my little one turned 5 last week.
Wow.
So we had gone out of town a little bit just to say, hey, the thing with kids' birthdays,
Yes.
I think I also celebrate so much. It always feels like it's my 5th year as a parent. So this was me celebrating 5 years as a parent. So yeah, so we came back this morning. So
Ah,
today I was working from home.
okay,
So
okay.
that's why you can see I'm looking all fresh and bright.
Yeah,
Yes.
today you're not in a car like me
Oh,
myself.
yes. And today my lighting is good. Last time the lighting beat me real bad. But thank you so much, Brian. Always a pleasure doing this with you. And to everyone who's joined our live, Karibuni Sana. Today we are diving deep into a conversation on medical insurance, and we want to see how can you stretch your medical insurance benefits so that you really get to enjoy your coverage. And as usual, I'm joined by the best in the industry. My colleague, also a teacher on my part, he's literally my medical insurance teacher also, Brian Jue of My Health Insure Talk. I was not supposed to say your name. Please introduce yourself, Brian. Thank you.
Yes.
Yes.
My name is Brian Jue of My Health Insure Talk. We just look at demystifying health insurance in Kenya. We just ensure that members know what they're supposed to be doing, how they're supposed to run their covers in a what can I call it, in an easy way, not complicated, not the jargons, just to ensure members know in a simple way.
Yeah.
Yeah.
And that's something something I really appreciate about you, Brian. And I hope if you're on this live or if you'll be watching it later, please make a point of following Brian. His handle is at My Health Insure Talk. My for MY Health Insure, then Talk, TALK. My Health Insure Talk. Please follow him. He always shares some really great nuggets, you know, on matters health insurance. So now, Brian, I personally have fallen victim of this. Okay, and I know a lot of my clients struggle with this. Like yesterday, I was speaking with a good client of mine. He's taken a medical cover for his mom, and she was in hospital yesterday, and she's actually hit the 90% threshold of her outpatient limit. The cover is due for renewal towards the end of October, and at the point where she is now, she can no longer access outpatient care on credit basis. Okay, so she's at a point where she has to pay in cash and get reimbursements. Okay, and a lot of us really fall into this where either we exhaust our benefits way before the policy term is over. So today, that is what will be forming the basis of our discussion, because there are many tips, you know, there are many things that Kenyans can actually embrace to ensure that we are not depleting, whether it's that inpatient benefit, if it's that outpatient benefit, if it's our dental, if it's our optical benefits. So now, Brian, please start us off. Okay. What should Okay, from your own experience, because I know you've worked for many years in this business, where do you think as Kenyans we are going wrong? When we get that, you know, medical cover, it's always a very exciting thing to have, you know, to know now I'm covered, I can access hospital XYZ. Where do we really get it wrong when it comes to our benefits or our covers?
Yeah. Thanks for that insight. Because it speaks to most of us and what we think about on the medical insurance front. You know, once you buy a cover, and many years ago, I also used to think the same, that you've gone and you've been told you have 1 million inpatient, you have 100,000 or 150 outpatient, or even 50,000. So at the back of my mind, I know whenever I'm going to hospital, there's that 50K, there's that 100K somewhere that I need to utilize. So either I need to utilize it fully or I need to utilize it almost, you know, the way Kenyans we are, you have to feel that I have used all the money until mwisho.
Yes. I've actually had clients tell me, my cover is expiring like in 2 weeks' time. I need to go. I've exhausted the benefits. But most people don't know what is actually the repercussion of that. But we'll get to discuss that a little bit later. Yeah. Please carry on.
Yeah, so you've been told you have 100,000, and as being Kenyan, you want to utilize it. And I usually tell people that, medical is one of the few insurance covers where you've bought, but you don't want to use it. Because, nobody likes going to hospital. But you have 100,000. So the first things I usually advise people is that know how much you're covered for. And then number 2, where can I go in case I fall sick? Where am I saying where you can go? By default, you know, if I have a cold, I have a flu, I have a headache, I have a stomachache, there are those providers that you can visit. So most insurance companies have what we call provider panel. They have their own providers that they've accredited, they've vetted them, they've negotiated discounts with them. So they tell you these are the hospitals that we work with. And so if you visit them, you will get a good rate. So that's the first point where you need to work with those. So work with your insurance company, let them give you the provider panel, have it somewhere stored safely so that you can be going through and seeing there's this provider, there's this hospital, there's this doctor, so that you can start knowing the Mali. Because you don't want a situation whereby you've fallen sick and you don't know where to go to.
Yeah.
So you find yourself walking into the nearest facility, and without naming names, quite a number of hospitals right now are right next to our doorstep, but they may
Yes.
not be the cheapest or available.
Mm.
So it's good to know which hospitals you can visit based on your policy. So once you get to know where you can visit, then that's at the back of your mind. So in case you fall sick, you know where can I visit, and I usually say that for outpatients, without just for adults, not kids. Kids, sometimes you can't
Take
say
chances.
yeah. And now that you mentioned you've turned 5, from year 0 to 5, that's usually the most critical. You find you're in and out of hospital, but from year 5 and above, you find slightly. Even the other day, the government has said that they're giving the polio vaccine, and it's for 5 years and below. I don't know whether yours was given the polio,
Not
or you're one of
yet.
those.
They didn't come in good time. But I think if they come, I'll take the chance, of course. Eh?
Yeah,
I believe in immunizations, by the way. Vaccines, yes.
yeah, they worked for us, especially during COVID. We saw what happened. Yeah, so knowing where to visit so when your insurance company tells you visit these providers, it's not that they're limiting you to certain providers, because they've vetted those providers, they've negotiated rates with them. So when you visit them, you get good service, and also at a rate that is negotiated compared to you visiting a provider who is outside the panel of that particular insurance company, and they've not negotiated specific rates for them. So that helps you stretch your benefits in some way for that matter. Again, we're not saying that you treat yourself where you fall sick and say that I don't want to use my cover because you want to try various concussions.
And
Usually see.
save on your cover for a rainy day. That sickness is the rainy day, by the way. Yes.
Yeah, I see guys with ginger, garlic, all manner of concussions, trying just to the cold or the flu away. But you're saying that you know your body well. You fall sick, just visit the hospital. But know which hospital to visit early enough. Don't wait for you to fall sick. Then you start asking for where can I visit. So the first step is knowing which providers or hospitals you can visit, and they're quite well known. If you ask your neighbor, your colleague, your friend, even by yourself, you've had experiences. There are those hospitals that are known as budget friendly. They give good services, affordable, and they're pocket friendly. So again, those will help stretch.
And I agree with that, because sometimes, especially for when it comes to like specialists, okay, you will notice that if you go maybe to a specialist who's not on the panel, their consultation fee may be as high as what, 6 Gs, right?
Yes.
While if you use the specialists on the panel, you'll notice they are capped at about like 3,000, because that is the pre-negotiated rate. Okay, so I love that, understanding even before you purchase the cover, having an appreciation of which hospitals can I access with this cover. Am I comfortable with that? Which specialists, especially for parents with young children, you want to be very keen on which pediatrician can I see on this panel? Just go through all that and see which pediatrician can I take my baby to. If maybe you have a particular need, especially for those of us maybe who have maybe their preferred gynecologist, ensure that you go through this, and confirm, like, is Dr. Wanjala on my panel? Because I am not about to see any other gyna in this town, you get. So I love that. That one of the key ways of ensuring that you get to stretch your medical insurance benefits is by utilizing the provider panel for the medical cover that you're taking.
Sure.
Thank you, Brian. How about, which is the second tip that you would share with people?
Second tip is once you visit the hospital and you're given a prescription.
Yes.
So you're given a prescription that says you need to get certain drugs. There's no harm in shopping around. The same way you shop around for a good pair of shoes, you're shopping around for a phone.
Yes.
Same way, no harm in, okay, unless you're in pain. But sometimes I usually say that, especially for people with chronic disease, they know where they can get medication. So don't be quick to pick the drugs at that particular facility. You can shop around, and you'll be surprised that some pharmacies or chemists, the ranges could be so much, so wide, quite. So you can shop around for drugs, even some lab tests, but mostly it's on drugs where you're able to put in a few savings. So shop around, especially for people with chronic diseases, so they're able to know I am diabetic, I'm hypertensive. This is where I can get this particular drug at a rate that is pocket friendly. So shop around. Don't be tied to one facility that this is only where I can get my medication. So again, most insurance companies have quite a long list of pharmacies and chemists, and you'll be surprised even some of the pharmacies at the hospitals could be affordable. Contrary to public opinion, you find people saying that some hospitals, their medications are quite expensive. That if you shop around, you get quite a number of savings on medication.
And I love that. And lately, I've actually seen a lot of insurance companies actually working with pharmacies, or medical drug providers, where they actually have negotiated rates.
Yes.
So if you maybe say if you are on the cover for company, what will you name? Bima Insurance, Mama Bima Insurance. If there was a Mama Bima Insurance, so you'll find that me as an insurance company have actually negotiated maybe with my Dawa, with all these other providers, where if you're using my card to purchase medicine at that pharmacy, you get like a 10%, 15% discount on your entire bill. You get? Yes. And this really goes back to, because remember, the cost of the medicine that you're taking, it's coming from your outpatient benefit.
Sure.
Okay.
Sure. Yeah.
So if you're able to get that 10%, 15% reprieve from your outpatient benefits, I think it is something that one should consider. And I love what you said, especially for those who are treating a chronic illness. So you know that every other month you get medicine. Okay, you actually go to have your prescription, a prescription refill. It's actually very important that you get to know between pharmacy X, Y, and Z. Maybe this is how much I get my Dawa maybe for diabetes.
Yes.
So who's giving it? Because it's probably the same brand, same everything, but one could be giving you at maybe 5% difference. So why not go for that? I love that, Brian.
Yeah. And of late I've even seen pharmacies coming up with some sort of consultation whereby they give a consultation of, let's say, 150 or 200 shillings, and then they give you medication. Because most insurance companies usually say you can't take drugs or medication without a prescription. So I've seen some pharmacies have a clinical officer or a pharmacist who can prescribe drugs. So you have a cold, you have these minor ailments, acute ailments, where I don't need to go and see a doctor who is charging consultation of, let's say, 2K or 2,500 or even 1,500. Why don't I go to this pharmacy? They charge me 1,500. No, not 1,500, on 50 shillings or 200. Then I get the same medication at even a lower rate than what I could have gone. And I've seen some insurance companies embracing this, because at the end of the day, it's saving on costs for that. So it's something that is coming up, and I'm happy that insurance companies some have taken it up. Just a matter of time before most of them catch up and start doing the same. Whereby now, for the acute ailments, you're able to get a small consultation fee, then you get the same. Because sometimes you have a flu. If I take an antihistamine, I'll pay, but I can't get the antihistamines over the counter with my card.
Mm. Okay,
Yes.
love that. Okay, so tip number 3. So far we've covered 2 tips. That is one, utilizing the provider panel that has been provided by your insurance provider, your medical insurance provider. Number 2, if you have a prescription, especially for those of us maybe who are treating a chronic illness that needs a prescription refill either every other month, ensure that you get to shop around and get to know where are you able to get your medicine at the best prices. And allow me to take just a small, to digress a little bit. Thank you for everyone who's joined our live. This is today we are discussing on how we can stretch our medical insurance benefits so that you really get to feel that full benefit of your medical cover. And with me, I'm with my co-host, Brian Njue of My Health Insure Talk. And it's me, yours truly, Mama Bima Kenya. So if you have any questions as we go through with our call, with this live session, please drop them for us. We'll get to handle them. You know, when you have Mama Bima and Brian on live, you're sorted. Cindy, so we are here. If you have any question on Martha's medical insurance, please feel free to drop them here on the chat. Now, Brian,
Yes.
tip number 3. What else can Kenyans do to ensure that we are able to stretch our medical insurance benefits?
Yeah, the other one, just to tie it in with what we were discussing, and I've seen it again coming up. It started during COVID. A few providers offering it. With COVID, it increased. And right now, a few are still offering it. Is what we call telemedicine. I know most Kenyans want to go and sit next to a doctor, explain how you're feeling.
I am most Kenyans. Please teach me. Yes.
Yeah, somebody tells you that, hey, no, I have to walk into a room. They take my pressure. They take my temperature. I sit next to a doctor. I explain, and I'll feel that I've been treated.
I've been treated.
But telemedicine is really coming up. For the acute ailments again, working well. I used it and I was quite surprised that consultation that time they charged around 400 shillings. That time I had an upper respiratory infection. I was coughing. They gave me a cough syrup and I think antihistamine or something. The cough syrup was almost 500 shillings. Total cost was slightly above 1,000. Then I asked myself, if I had gone to some hospital, first of all, I look for parking, I queue. By the time I'm done, deliver parking. But why do they charge parking? I've never understood.
Yes.
You've paid a bill of 6K and somebody wants you to pay 150. Yeah. So I asked myself, hey, this is interesting because I was just at home. I didn't leave home. I've spent 1,000. The drug was delivered, and within 3-4 hours, the drug was delivered, and I was well.
Wow!
So
the convenience.
The convenience was quite out of this world. So for the acute ailments, telemedicine is working, and the rates are quite again different from when you go to see a doctor. And trust me, it's quite different. I've seen even guys doing telemedicine where it's no longer you're not calling. You can even video call for that. So they're able to assist you on quite just the acute, not the complicated cases. The acute cases. Yeah.
Brian, I know we keep talking of acute illness. Please explain to those who joined this live, what is an acute illness?
An acute illness is an illness that does not comes and goes. It's not long term. For example, with a cough, you have a respiratory infection, you could be having an eye infection, things that 3-4 days it's over. So those are what are called acute. Chronic are the ones that require long term, the diabetes, the hypertensions. Yeah, so the acute, ile ugonjwa inakuja ikienda ikai sana.
Yes.
Hiyo. Yeah, so those ones can be treated well with telemedicine. And the good thing with the telemedicine is that they have your records. It's seamless. You're not filling in forms, and it can save. As you can see, I spent almost 1,000. If I could have gone to even the budget providers, not less than 3,000.
Yes. For sure.
Yeah.
Plus the parking fee. Now that you mentioned parking fee, I'm already feeling, oh my God, parking fee. Like not September. August was a tough month for us health-wise. My little one came down sick twice in the month, and one of those, the first time was literally like at 2 in the morning, and you should have seen me crisscrossing from one side of town. Like I was literally driving. So you guys mean machonne, so I don't even see that well in darkness. You should have seen me driving in the dark, heading to all the way in Westie, because I think for me, Westie, Parklands, those sides, I don't take chances. Like when it comes to my baby, for me, I can enter even a budget hospital, but like for her, I feel I have to go to hospital. So that evening it was drizzling, and I was there, driving, and fine, we went, saw the doctor, and of course it ended up actually being an admission. And yes, and we were in hospital for about 3 days, and then I also got sick. Kumbe, I was so stressed by my baby being unwell. I got so sick, and I had all these symptoms that were almost manifesting as, COVID / like, because it was a lot of pain in the chest, and like problems even with breathing. You should know what the diagnosis I got at the end of this.
We see them. We just laugh.
Oh my God. I think mine was so asymptomatic. My symptoms were so up here that they were manifesting as so much pain. They were manifesting physically, but last month was one of those months where tulikimbizwa, like even on her actual B-day, when my baby was literally turning 5, we were in hospital up until 11:30 at night.
Wow.
So it was one of these, I was there asking God, like, God, what is it? Like, you come from work, you brought candles, you want to cut cake with her friends at home, and you get there, you're hugging your child, and she's literally burning up. Of course, so you drop everything, Paki. I always move from one side of town to Paki, because at least that is the one hospital where I feel, and I'll tell you why I really love that hospital, is you can tell they're allies when it comes to helping you stretch your benefits. They don't overdo things. I've gone to hospitals where, a 2-day, 3 days stay for the little one, it's a 300K kind of bill. But that particular one, you can tell they're very keen. They don't overcharge. They are very human. So that's why I do find myself moving from one side of town to Aki many times, especially when it comes to seeking treatment for my little one. But I must tell you a story. So something that happened to me during that time, because so eventually I got a diagnosis of gastritis. Okay. But before then, and I know this one will probably come in one of the tips that you'll share with us. I went to like a major doctor's plaza within town, like within Nairobi, and because I was in so much pain, I entered a specialist's office or clinic, and he's a physician / cardiologist. And let me tell you something, Brian. Within 15 minutes, I had run my card for over 19K. I had the consultation. I was done for an echo. I was done for an ECG. And within that time, I was literally sent for admission. I was told to go to the admissions. And he, the doctor told me, we need to have you stay in hospital maybe for a day or two. We need to run other tests. And I think it really took a lot of me just speaking to my husband. I really had admission already. So at the admissions desk, actually, that's how we made up our mind. We were like, no, I think we need to seek a second opinion. So I went back to that hospital. That hospital that I love in Turkey.
Know your hospital. Know your hospital.
That hospital. And that's where my diagnosis for gastritis came from. And I can tell you the medicine I was given that evening, I woke up feeling brand new. I could finally breathe. I could walk without any pain. And, so the following day I kept thinking, oh my God, I would be in a hospital bed today. I would be somewhere in hospital, probably being wheeled from one radiology room to the other, having I don't know what kind of scans done. So not September, August was very eventful health-wise. So right now I'm very grateful to God that all is well. But when I look back, I'm like, oh my God. Thankfully, I work in the business of insurance, so I am well covered. I'm very fortunate, to have ample outpatients and even more than just one cover. But when I sit down and really think of what I went through, it's actually sad. Yes.
I really feel it because I mean that happens to even me when when was this 2 weeks ago? We took our young one, 1 year old, who had bouts of diarrhea, and you can imagine the doctor told us that according to and I'm sorry this is happening in most hospitals. The doctor said that according to what we're seeing here, the management says that the baby must be admitted. So she admission? No, we don't think so. But the good thing the doctor told us, but that from even the doctor had a young one, and she told us no, this one will go away. But with A, B, C, and D, just to ensure. But if she was to put in the same diagnosis and everything else, end result,
cannula
on that one.
Mpewe maji
Mpewe maji.
2 days. Yes.
Then mwanze kuulizwa mtakula nini kesho asubuhi.
Yes.
That's the 5-year-old.
Yeah, that's she's not getting where I'm in the balcony by myself. Yes,
she can't.
Okay. I can't.
She's
wondering. That's the beamer behind there, but now she's in good health, and we thank God.
Of course.
Yes. So far, Brian, we've looked at 3 tips on how we can stretch our benefits. Utilize the provided panel that is of hospitals and specialists. Also, when it comes to your prescriptions, just shop around and see who will give you the best prices for your medicine. And lastly, utilize telemedicine. And on that issue of telemedicine, Brian, especially when it comes to like therapy, have you or any of your clients had an experience of being able to access like psychotherapy sessions through telemedicine?
Clients?
Yes. Have you had an experience where maybe a client of yours has been able to access psychotherapy or therapy sessions through telemedicine? Because I feel that is one of the fields that will, really help a lot of people because of the privacy where you get to, you can be in the house and just go online, with your doctor and speak, and have your session. So the privacy, because I still find there's a lot of stigma, because most of the hospitals where you go to seek these services, like, counseling services, therapy services, they are hospitals, they're mainstream mental health hospitals. So I know a lot of clients literally who stay away. They need the help. They need to go see, they need to go see a therapist, but they stay away because they feel like, I see your hospitali ni hospitalia. You get? So I feel that especially the telemedicine service can really help in bringing, like, lowering just that stigma, making the process of being able to access mental wellness or mental health medical services, like, just better. Because if I'm in my house and I'm able to just log onto my phone or onto my machine and speak with a doctor and we have my session, I just find that really, that can be really convenient.
Oh, yes. Quite. Most insurance companies, a few insurance brokers have telecounseling where you can call. Some even have toll-free lines where you can call and just seek counseling. And it's quite busy for that matter, because as you said, the stigma is still there. Nobody wants to be seen walking into the hospitals, that deal with that. So most clients' point of call is the telecounseling for that psychotherapy. Then if need be, then they might be referred now to a physical meetup. But 60-70% are handled on phone. Sometimes somebody just wants a listening ear on the other end, and the day is well done for that particular person. So most insurance companies have seen that, and as I've said, a few brokers in the market, insurance brokers, have telecounseling. Even some have toll-free lines where you can just call without you paying. Sometimes somebody says, "Hi, I'm going to talk for 30 minutes. That's my airtime." And this economy, no. So some of them have toll-free lines where you can just call, you're not being charged, and it's really, really helping in that front for the sector.
Give us some more insight into that, because I know that is the side of the market that Brian, by the way, works at. Big fish, brokers, the main underwriters. So, Brian, when, for example, if a broker has like a toll-free line, so when you're calling, are you calling a doctor who is based at the brokerage, at the broker, or is it like a mainstream doctor whom they have hired, like they have contracted to do that work for them? Just give us a little insight into that.
What happens is that some brokers do employ psychologists who are full-time. That's their work. They just man the toll-free line and they answer the calls. Other brokers have contracted these psychologists based on the number of calls that they receive. If they're not so busy, then they might want to contract. But the ones that are busy, they've employed them to that. And most companies nowadays really employ most of these clinicians. You have a psychologist, you have a pharmacist, you have a nurse, a doctor, because this health industry is quite wide and dynamic. So you want your company to be set up in a situation whereby you're able to offer 360 service to your clients. So and mental health right now is quite a big issue. So that's why most companies, the ones that are progressive, have seen it advisable to employ psychologists in part of their staff, so they're able to man that. And it's confidential. I'll tell you, it's quite confidential. That whenever a member calls, they talk, and the member, from reports that I've had, even just speaking to peers, in the industry, it's quite something that is coming up, to the extent that you're seeing companies contracting them for that. Yeah, so it's working, and the members are really utilizing it, and I'm happy that the industry is taking it up positively, for that matter.
Well, yes, and by the way, if you look at the clock, Brian, you will be shocked. I don't know where our time right now, and we have like 15 minutes to wind up our live.
Yeah.
So tell us, what is that fourth tip that you can give our listeners, people who will actually get to watch this live once we post it? What is that other tip on how we can stretch our benefits?
Tip number 4, based on what we've been discussing,
yes,
is don't feel shy to ask for a second opinion.
Yes.
To get a second opinion, and from a doctor in the same field, or from a specialist, just tell them that, hey, I was told that I need to undergo surgery. I need to go for this. What do you think, or what do you feel? So asking for a second opinion does not hurt, as I've always said, because it's your health, it's your body. Some facilities are quick to suggest surgery because they can see you utilize that. So seeking a second opinion is quite advisable to stretch your benefits.
Okay.
So you're quite sure that what I'm going for is absolutely necessary.
I love that, and I love that. I mean, I just shared earlier that I was on my way. I was literally at an admissions desk. I think what pushed us to the very end, like with my hubby, was when we got to the point where is it called a cannula? The one dawa. So I am those people, either I'm so chubby, they never get my veins by the I'm not my veins, they disappear. So when the first nurse really tried to get it, like ilikuwa tu ile shui, like she couldn't get it. So it was so painful. So then she said, let me get my colleague who's better at finding such. So she went. So when he came back, he tried to get it on these beats. Oh my God. The pain. Then once he managed to actually put it in, but within 5 minutes, my hand had swollen so much and it had started darkening, like it was getting a navy blue kind of thing, like, like a bruise. So, of course, at that point now, we just went like, no, swollen. I think this is our sign that this admission should not happen. Just remove it. What I mean, so yes, but yes, I think getting a second opinion, because we moved from an admission to literally a diagnosis of gastritis that was treated like really fast. So I agree. I see on the comment section, Kamson, I'm guessing this is Mudani. She says we save the life. Yes, we will, dear, and we'll cross share it, like we'll collaborate on my page, Mama Bima Kenya, and also my Health Insure Talk. So please make a point of following the amazing Brian Jue. He always shares really great nuggets on his page on matters medical insurance. And also, if you don't follow me, Mama Bima, click bonyeza hicho kidude. Follow. This is the home of you learning so much on matters protection, and now in the case that today we are discussing, medical insurance. Brian, any other tip? Do you have any other tip from your end?
Yes, I do. Ask questions. Ask questions. And that's why I love this generation. I don't know now. It's is it past Z, or where are we?
I think I don't go on Gen Z unless I to channel as you are old.
This generation asks questions. I'm telling you. I think in our generation we were told not to ask questions. I don't know.
Yes.
But ask questions. When you go to a facility and you're told you need to go for an X-ray, you need to go for a lab test, we are giving you the drugs. ask questions, because when you start asking questions, even the facility, okay, huyu amekuwa mjanja, because I mean you can't be walking in with a toothache and these guys want to take your stool. It doesn't add up. So ask questions. I mean, why are you telling me to go for this? What does this drug do?
Yes.
Sometimes you've been given like 4 painkillers. I mean, ask questions. So asking questions doesn't harm, but it helps. Even you as you're going home, you know, niliambiwa hii inanisaidia hapa. Hii inanisaidia hapa. Because again, we don't want to have a mini pharmacy at home, so that it's crazy. So ask questions. It's another tip, because the facility and even options. Ask options. You're asking questions and also options. Is there a cheaper or a better drug to this? Because Kenya is one of the few countries where doctors, or is it okay? I've spoken to a few doctors and they tell us it's us as patient who insist on brand drugs. Most countries, they don't rush to ask to prescribe brand drugs. Ask, is there a good alternative to this drug that you've prescribed me? So options, questions, it's your health at the end of the day. I'm seeing someone ask, some doctors don't like being asked questions. It's true. Because they know that once you start asking questions, but I mean, it's your health. It's your health. Ask questions. The same way you're walking into somebody's telling you something that you don't understand, you ask questions. So don't feel threatened or shy. Ask daktari. Once most people start asking questions, they'll need, because a doctor by training needs to explain. If you go to the old school doctors, the ones, I don't know to say the ones, but they will explain to you they're doing this because of A, B, C, and D. You don't want somebody who is just nowadays is it clicking or swiping? Whereby you tell them nasikia hapa, they're just typing. At the end of the day, you're told, enter lab, enter pharmacy. The guy is done with you within 3 minutes. Old school doctors, there's a doctor I visit, the guy has no computer, no laptop. Unaingia ile kitabu. The guy listens to you for like 20 minutes. And you live there, you feel, So don't be afraid to ask questions. Ask questions. Ask for options. Look at your bill by the time you're leaving the facility. Ask for an itemized bill. Sometimes they just write treatment 8,000, so you don't know what was done. Ask for itemized. I mean, see, consultation was this much, drugs were this much, this drug was this much, there was this lab test. It helps a lot, because it's your health, it's your insurance cover. At the end of the day, I usually say, if you are paying cash, what would you have done?
Ungeuliza.
Ungeuliza. Hapana daktari, x-ray nimekataa hiyo. So the same way, you're paying cash, you're using insurance, it's your health payment at the end of the day. Doesn't matter who's paying, but you at the end of the day.
I love that. So as I know our time is winding up, but tell us, how can we utilize NHIF? How can NHIF come through for us to ensure that we are literally also stretching the benefits of our private covers?
Hey, Mama Bima, this NHIF, keeps morphing. So I don't know where the current one is. I've been trying to get a hold of those bills, and they've not made them public yet. The three funds that were suggested recently. But what is there, the usual NHIF that was there was that as long as you're contributing, you can utilize it. People have been told, select one provider for outpatient. You can just check if it's a provider that is within your region. If it's a provider that, because you'll be surprised, some providers that you think are not on the NHIF panel, actually
they are there.
They are there.
Yes.
Yeah, they are there.
Very good hospitals, actually.
Very, very good, and they can ask you to stretch, because now you're going to use you're being deducted every month for
Mm.
NHIF. So why not
Yes.
use it when you fall sick for outpatient?
Yes.
For inpatients, they've been paying for things like dialysis.
Mm.
They've been paying for some conditions, surgeries. In addition to the rebates, the bed that they usually normally pay.
Yes.
So at the moment, I can't comment much until they publicize those bills, so that we go through them and see how actually this will play out. But it looks like a good idea, whereby there's a social aspect, there's a critical aspect, and there's a primary healthcare aspect. So if it works the way it's planned to work, then it will change healthcare in Kenya, because healthcare in Kenya is too expensive. Sometimes we want to blame users or the members, but healthcare is out of this world. It's quite expensive. Yeah.
Okay. So now, and I see Dominic had chipped in. There's a new generation. I think they're called Gen Alpha. So I'm not sure if those are this generation of our 2 5-year-olds and below. But we'll get to check that out to know who these Gen Alphas are. But now, Brian, please wrap it up for us. What is that last tip? Do you have any other tip, or do you want to say, like the last words? We have 2 minutes to actually end the session. But you can stretch it. I can add you an extra one.
Yeah, I can see it's getting dark here.
Yes.
Last tip I usually say is treat it as the same way you treat your money when you're paying cash.
Yeah.
Because if you're paying cash, you act differently. You ask questions, you ask for options, you keep the doctors and everybody else at the facility on tabs. But if you now produce your cards and then sit back and wait for you to be tossed from one area to another, because this is a private facility. Their main objective is to make money. Unlike government is whereby, or even faith-based, where they have an element of helping the members. So at the end of the day, they want to make money. So use the insurance cover as you'd use your own money. Na kuna pesa nabaki huko. Ati I was covered for 50,000, now I've only utilized 30. Hey, I'm
Yes.
20,000, so hii watakuta.
Yes.
Yeah, it's a benefit. If you check the premium you're paying, it's not the same as because you're being told to pay around 50,000 for you to get a 1 million cover.
Yes.
Or maybe 50,000 or even 75,000 outpatient. So you've not paid 1 million to the insurance company. You've paid around 50. Yeah. So it's the pooling of risk. That's how now insurance works. So if you look at it that way and you look at it as your own money, then you should be able to use it wisely and make it sustainable. Yeah.
Yes. Thank you so much, Brian. Today, this was a really good session. And the one thing that I'm cognizant of is when we are going to hospital, we are usually very vulnerable. You're unwell, your baby is unwell. So you're not as, even your decision making. That's why I literally went, consulted, did an echo. Did that. I didn't ask even one question. I was just there looking at the screen, seeing my heart beating. I've never seen my heart before, but I think I was even borderline excited when you were saying like your heart is okay. And I was sent to the admissions, and I didn't even query anything. I didn't, but I think this tells you, and it was also a learning point for me. Yeah. I think we need to be just more confident. Yes, I appreciate that we are vulnerable at that point, but maybe from the very first point that Brian gave on one, understanding your providers, so that you're not just walking into any doctor's office, you know that if you need maybe a good specialist or a good physician and you're within this area, maybe I can walk into Dr. I still insist, my favorite gynecologist in this town, Dr. Wanjala's office. Wherever I am, I know I can just I ran to Dr. Wanjala to see him, or maybe a pediatrician that I really want to take my 5-year-old. I can go maybe to Dr. Wafula in those sides of West East. So I think it's what basically we've been discussing today.
Yeah.
Get to know your panel very well, like who's on that provider panel. Shop around for your prescriptions. Consider using telemedicine, you know. Ask for a second opinion, ask questions, and please also ensure that that NHIF cover, of course, our NHIF is really morphing into something else, but even with what we have currently, because I can tell you, 3 weeks ago, NHIF literally paid my, bed rebates, at the hospital when my little one was admitted. So it's still coming through for us. So ensure that also your NHIF stays active and it remains paid up. Okay. But thank you to everyone who joined today's session. We will save this live. We are going to do a collaboration between Brian Njue on his page. His page is at My Health Insure Talk. And I'll collaborate with him from my own page, Mama Bima Kenya. If you are watching this and you don't follow either of us, as I keep saying, my favorite Swahili line, bonyeza hicho. Bonyeza kidude. Follow. Feel free to also share this session with your friends, with your families, people who, maybe have medical insurance or are considering purchasing medical insurance, and you would want them to really know how they can fully take advantage of their plan and to ensure that it actually sees them to the end of the policy term. Okay. And one last thing, I hope you know that one of the repercussions, by the way, guys, of overly utilizing your cover is an increase in premium year on year. There's a possibility that your premium, if your utilization is very high, that your premium will be loaded. That's what we call it in insurance. But we can always talk about that on another day on what could actually lead to covers being loaded. So Brian, please give us your closing remarks. Tuseme kwaheri.
I thought I give the closing.
Sasa tu ingine unanijua, nimeongea sana. Sasa ambia kwaheri tena.
Yeah. So I like what you said, that if the utilization is not quite good enough, then the premiums will be increased. And what happens is that year 2, year 3, you find you're paying slightly more than what you paid initially. And the good thing with you letting your cover well is that the next year they might add a few benefits onto your cover. So there are quite a number of benefits on utilizing your cover wise, and the most important, it's your health, because you're going to hospital. These are drugs being administered to you. If it's not really necessary, then you should not. But as you said, for kids, there's nothing much we can do. But for us as adults, then we have some level of control on what to do and the choices we make. They said choices have
consequences. Yes. Okay. Thank you so much. Thank you to everyone who joined our live. It's now darkness is here. Thank you so much for your time. And until next time, kwaherini.
Kwaheri. Thank you for joining.
Thank you, Brian.